First up, I'd like one of those t-shirts as well, please, Steve, if you can just contribute them to the rest. We've only got 20 minutes and we've got a lot to get through, so we'll try and do quick fire. So I just want to thank the panel first of all. We've got Charlotte Hespe from RSCGP. We've got Michael Bonning from AMA.
Not as short as I look in the photo.
Taller in person. They've just given him a short picture, so apologies. And we have Liz DeSoma from Medicines Australia. The panel's here to discuss some key findings from the AusDoc Big Doctor Survey, which, as it suggests, is the biggest survey we've ever completed. We had north of 1,000 doctors give us their opinions on relationships with their careers, with the pharmaceutical industry and with government. And just to take us through it quickly, we have our research partner, Donna Collett. Welcome to the stage.
Thanks, Bryn. Thanks, Bryn. Okay, I'm going to give you some context on the survey that was conducted over 4 weeks ago, or just around 4 weeks ago, and we collated data from 1,000 doctors. Just the demographics across the top, you can see it was quite balanced in terms of gender, location and age groups. And to give you some background around the specialty, there were 62% GPs, 32% specialists, and the rest were registrars or residents. It was quite an experienced group overall, and you'll see from the hours per week that we excluded anybody who had less than 10 hours in terms of clinical practice. So it was tapping into people working clinically greater than 10 hours. Okay, in terms of career, it was pleasing to see that 71% of doctors are satisfied or very satisfied with their current role as a doctor. So you think, okay, that looks pretty good. But then we delve a bit deeper and look at that in the context of time. And it's a different story that emerges here, that 49% of doctors said that their job satisfaction had worsened over the last 5 years. And the main reasons for that were workload, burnout, some people don't like APRA, remuneration not being sufficient, or that a sense that the healthcare system is broken and feeling frustration. So that's a little bit around career, and next we move to the pharmaceutical industry. And the uncomfortable truth is that the NPS score for the pharma industry was -68 in response to the question, how likely is it that you would recommend the pharmaceutical industry in Australia as making a positive contribution and to medicine and patient outcomes to a friend or colleague? The least negative were specialists and potentially older doctors, baby boomers and Gen X. But I'll leave that to the panel to comment on that in a moment. We then looked at engagement measures, and there were 4 measures we looked at: relevance, value, collaboration and trust. And you see the weighted average scores out of 5 for each of those measures. So relevance was the highest score, but concerningly, trust was the lowest. So about half the sample had trust, which was considered adequate, good or great, but half rated it as poor or fair, which is really concerning. Then, so you might say, well, what can we do about that? What can pharma do? And we asked that question as well. So what doctors want pharma to do more of to support them? The top 2 areas were supporting patient access to medicines and providing education. But nearly 30% of people said nothing. And then, coming back to that area of trust, if 2 medicines are considered clinically equal, we said what factors tip it in the balance for your medicine, one medicine over the other? The 2 standouts were price and patient choice, but the third area was trust in company. And so that's an area that requires focus, and I'm sure the panel will focus on today. But I'll hand back to you now, Bryn.
Thank you, Donna. Some fairly confronting things come out of that. Thanks very much for the clicker. And I suppose most importantly now into the panel discussion. So we've called out a couple of the big pieces that have been featured through that survey, provided I can click the button. There we go. So talking point number 1, career frustration. So 53% of doctors would choose medicine as a career again. So that's fairly shocking in and of itself. And only 35% would encourage their child to follow in their specialty. So I suppose to Charlotte for this one. Does that shock you? And what does it mean for general practice?
Does it shock me? I don't think it shocks me. It saddens me and concerns me around how we need to structure what a career in medicine looks like. I'll take the positive. There are 47% who would. But, you know, realistically, if we're looking at the general practice population, this has been a growing murmuring of disgruntlement, burnout. COVID obviously did nobody any favours in the medical profession. But for me, I think the really thing that we need to call out is the system that we're asking clinicians to work in is a system that was designed back in the 1960s to solve the problems of the 1960s, which was actually about equitable access to care. And we designed a great system, but it has not morphed, it hasn't changed. It's been added to and become this ridiculously cumbersome, red tape, administrative, burdensome place to work in, rather than actually transforming into a new animal. And that's really what's going to need to happen to change. But can I say, I personally love my career. I would not have chosen anything different, and I tell people all the time, being a GP is the biggest privilege you can ever have. So let's go out there and make sure that that song gets sung to the growing population that we are fully subscribing to, certainly this year.
That's wonderful. Michael, has medicine, I suppose, lost its prestige as a career? Is there anything that more can be done?
Look, my son's 18 months old. I've got him working on what left ventricular hypertrophy looks like. So, you know, it's a starting point. Look, it hasn't. There's 27,000 people every year who try and make the process of getting into one of the 4,500 spots that exists at medical school here in Australia. You know, has it lost its prestige, or are we really talking about differentials? I saw in the Financial Times just yesterday or the day before, you know, we're losing the brightest amongst us to hedge funds or to consulting or to, and I think what we're really saying is we're losing a certain group, but the ones that I get to teach, the ones that I get to work with, whether they be students, registrars, all the way through, or even high school students, they come because it's meaningful and what they get to do with it. It's not numbers on a page or anything like that. It's, you know, they have a real sense of the value that they can provide to people's lives, and they're the people I want. You know, I want to stand in front of a room of high school students and say, it's hard, it's challenging, and maybe to many of them this isn't for you, but for the 4 or 5 in a high school class that I can find, they're the ones I'll take, because they're the ones who'll do it for 50 years, and it will be for them the most meaningful thing they could ever do.
And finally, Liz, what can the industry do to help? What can you do to support this vital function of doctors in medicine?
But use my microphone. I usually speak quite loudly, so probably don't really need one. But honestly, I was quite, not shocked, but disappointed that there are still those perceptions around the pharmaceutical industry persisting, and I know that we'll get further into that discussion, but I think what it does show me is there is somewhat a lack of understanding between what the industry can and does do and what GP, primary care and specialists can and do, and how they can actually collaborate better together. And I think that the one word that was missing from our last presentation, and one that should be included in this presentation, is patience. Because we talk about patients all the time, and yet it's not something that we necessarily collaborate on when we talk to doctors. We talk about, you know, results and science or sales or options, and we should be talking more about the patients. So I think that there is a lot of education that the industry can do, and relationship building that they can do with primary care practitioners.
Thank you.
Thanks. I can't believe I get to do this one. I mean, when this Net Promoter Score came out, we were sort of guessing what it might be. Everybody knows what a Net Promoter Score is. Everybody knows that, yes, if you've got a very wide question, the Net Promoter Score can sometimes flick around a little bit, but 1,000 people answered this. And I think we've talked about trust this morning, how much HCPs trust us and other things. And I think we assume that. We've asked 1,000 doctors, and I'd like to probably start with Charlotte, because we've obviously got something to fix here. If 49% of those that were asked lack trust in pharma. So, Charlotte, what can we start doing to build that trust?
Look, I want to start just with the elephant in the room. First up, what is trust? And if you look at the definition, it is about a firm belief in reliability, truth, and the ability of the person or entity to do the right things. And the context of pharma, I think, comes on a big elephant in the room around the paranoia around big pharma, and that big pharma is there to do harm because all it wants to do is make profit. And so it loses it isn't about the patient at all. It is very much about the profit. So I suppose part of the lesson that we need to talk about is actually, if you continue to talk about the marketing and the company and the strategy without actually making sure that this is actually about improving the patient's journey as a sufferer of an illness and a disease, then the trust may not actually be able to be rebuilt. And so we do need to reframe. What is pharma there for? I know pharma. I could not do what I do in the modern day of technology with all the amazing medicines that I can prescribe as a result of all the research, scientific evidence, and then the ability to market those products, particularly in the Australian setting. But that gets lost when people are just fearful that this is just about profit, and there is no sense about what it is actually doing for the quality of life and the healthcare journey of both, of our patients.
Thank you, Charlotte. Okay, Michael, be really honest. What shall we stop doing as an industry?
It's interesting, isn't it? Big supplements seem to get away with a lot of things that the rest of the pharmaceutical industry doesn't, And part of that comes to what Charlotte was saying, that what is the focus, what is the pharmaceutical industry perceived as doing? I think in that it is about changing changing how the relationship works. We as prescribers of many thousands of medications want to be engaged by people we trust, which usually means other healthcare providers, and to think of it in the context of how do we solve for the challenges of our patients, because at the end of the day, when you do those things, that is when that is when we all leave the room, I think, feeling like, well, that was a huge value add in how do I solve the complex diabetes challenges that I see? What about the new frontiers in AF management that need to be part and parcel of what we do? And the only way we're ever going to do that is with you.
Thank you. And Liz, does that shock you? And what can we do about it? What can Medicines Australia do to help?
Look, it breaks my heart, actually. I think Medicines Australia certainly has a focus on accessibility of medicines for clinicians and for patients. Our focus is on making sure that we meet high regulatory standards, high ethical conduct standards, that there is honesty and truth in all of our communications and promotional materials. Our regulatory framework for self-regulation of promotional materials is very rigorous, and Medicines Australia leads the world in that standard, and I don't think that many of our healthcare practitioners realise how rigorous the code of conduct is in managing promotion of materials. I think the thing that also frustrates me is this profits before patients. This is a highly risky industry. Investing in research where, out of 10,000 research molecules, only one will reach a patient, investing billions of dollars into failures. You need to make profits as a commercial entity in order to reinvest profits into people, talent, research, collaborations, clinical trials, all of those things. And yet there is still this belief that profit is bad. And yet, you know, we don't have many conversations about how much profit the specialist is making to work 3 days a week. And that's not bad, because he's very, very clever, and he's helping patients. But we do talk about the profits that the pharmaceutical industry is making, because we don't believe that what they're doing is helping patients. And I think I get frustrated by that. And why aren't we working better about telling the story about what money is used for and why it's important to make money in order to reinvest money into the next innovation. I also think
Shots fired, by the way. There we go. We'll come back to this.
Never shy about firing shots. I also think, you know, mutual respect, and I think you raised it. You know, I've been at a few lectures with medical students, and they're taught from a very early age not to trust pharmaceutical industry. For second year population health, medical students stood in a room and said to me, you put profits before patients, and you bribe doctors, and your clinical trial data is dishonest. Now, they're being taught that right in the early ages of their education, and they go through their whole medical training being reinforced that we're not a trustworthy industry. So I think we can work together on that right at the very beginning, when we're teaching young students who do want to help patients, that we actually have something to do together. Sorry,
I think it is one of those challenges where if you don't have people working on the forefront of the delivery of whatever is cutting edge, sometimes they don't get to have the same level of voice at that early stage of teaching, which is, I need these drugs to solve really complex problems.
Now, conscious we've got 2 minutes left. I was concerned we'd run out of time, and we're definitely going to. We've got 2 more points, but we're going to stick to one, and we'll just combine points 3 and 4. So I suppose this is the upside. So more than 600 doctors opted to contribute, basically to talk about the contribution that Pharma makes, and without them, that they're basically, it's the vital contribution of Pharma. Now, you guys have actually seen the kind of the individual responses. Michael, do you want to pick one that resonates with you and just bring that to life?
I think Elizabeth kicked this off nicely. You know, the reinvestment of profits. I'm right there to understand that we need the scale of the pharmaceutical industry to embark on late stage trials. I've been involved in trials in different contexts. I used to work in the United States, and the ability there to see challenges, look over the horizon with great talent and really bring that talent in is fundamental, because otherwise, we'd only have a couple of drugs for heart failure, and now we fundamentally change people's lives by the medications that we have access to, and so that will always be a need in the future. There is some sense in that, though, that if we can also take that and look at some of the other neglected areas, and while we didn't say this, I chair public health for the AMA, so I'm always going to talk about neglected areas in our context, but I think that's it's fairly important.
Charlotte, as briefly as possible. I think you've got about 30 seconds.
As briefly as possible, there is no doubt we need and value the educational updates. There is such a large amount of new, innovative and amazing medications coming onto the market, and we need to make sure that the practitioners know and understand them. GPs in particular have an increasingly complex world to navigate with respect to multiple medications. I am a holistic doctor. I look after every organ. I don't just look after a heart or set of lungs or a gut. I actually have to navigate what that looks like. Please assist us in patient-centred education, and I know there's already some great programs out there, but that is the value add.
Thank you. And Liz, any final thoughts for the room?
Very quick. Pharma industry should walk the talk. We talk about it, we should walk it. We need to work together, advocate for each other instead of just for ourselves.
Thank
you. Collaboration.
Yeah, thank you.
To quote Steve, if you want to grab your phones, there'll be a longer version of this taking place at a webinar at the end of November. There's clearly a lot more to talk about, so grab your phones, register.
Get your phones out. And if you want to come to stall 6, we've got this QR code. But thank you to everybody. And we're obviously going to present the full data on the 25th of November. So scan away.